Hello, this is Ben Stronach, and this is a video about utilizing TraumaCad software for total knee arthroplasty templating. I like to start with templating my resections and alignment levels, and I utilize long-standing radiographs to do this. I want to ensure that we've got a nice AP pelvis with forward-facing ankles and forward-facing patellas on the radiograph. We then load this into TraumaCad by right-clicking and exporting into TraumaCad. We now click on the radiograph of interest, and then we're going to select knee as the procedure. Once this is done, we're now in the system, and this is cut off a little bit compared to the screen that you're going to see based on the fact to protect patient privacy. So I've selected AP in the right knee, and we're now going to oversize at 110%, which has been validated. Now for the tools, we're going to utilize the long leg resection tool, and this gives you quite a bit of information as seen here. This window shows you where you're going to be clicking to show landmarks, and this is going to be written out as to what the landmarks are. This tool called the magnifying glass will show you the magnified area on the radiograph. It's not real helpful for the femoral head, but you can see that it's quite helpful when you look at the femoral shaft and you're able to pinpoint where you want this to be on the femoral shaft. So I'll look at the main image to get in the ballpark, and then I'll zoom right in on the magnifying glass. Now when you lay your points down on the femur and the tibia at the joint line, you want to be fairly accurate here because that is going to dictate your resection levels. So we'll now finish off by going to the medial and lateral shaft and then selecting the medial and lateral portion of the ankle. You now get quite a bit of information as seen here on your femoral and tibial resections along with your angle of your mechanical to anatomic axis on the femur. And when you come on the image and look at the actual lines, you can grab the distal femoral resection and move this proximally or distally, and the values will change accordingly. The same can be done on the tibia. I use these as relative values. You want to know roughly what resection you want to make depending on your implant design and the deformity that the patient has. If you're going to keep the font for the mechanical to anatomic axis, I like to go ahead and blow this up to a larger size, but we're actually going to get rid of that here in just a minute. You can also grab these yellow dots and change the angle of the distal femoral and proximal tibial resections. And when that happens, a little warning box comes up to tell you how much you're changing the varus and valgus for these resections. I prefer to do a mechanical axis resection, so I typically want these to be neutral and not change that angle unless I'm doing something complicated from a revision standpoint. Now I like to hide the alignment lines and also hide the mechanical axis lines, and this gives you a cleaner view to be able to see your resections. I'll then put back up the information saying what the mechanical to anatomic axis angle is for the femur so that I can just look at this directly in the operating room and not have to look at the report while we're in surgery. So this is what that looks like completed, and then we'll go ahead and save this report. I now want to review how to template for implant sizing, and this starts with looking at an AP and lateral view in our PACS system, and I will send this over to TraumaCad. With the way my system is set up, we first have to load one image followed by the other. Depending on your system, both images may load at the same time into the TraumaCad system. I'll now click on both of these and then select Next to move forward with the images selected in TraumaCad, and we're going to choose knee for our procedure. You now have to go through both images and tell it that you're working with an AP on the right knee, and we're now going to do 115% on the oversizing where the long standing was 110%. We now have to load the lateral, and that this is also the right side, and also give it our oversize. You can certainly use a marker ball here if you choose. Now, instead of using tools, we're going to go to our templates, and we're going to select our implants. In this case, we're going to utilize a DePuy Attune system, and when we select the implant of our choice, it is then going to give some alignment tools on the image. Now, the information that we gathered from the initial templating session is not carried over here, and so the numbers you see will be slightly different. There's a little bit less of a medial tibial resection on this templating session. You can adjust this utilizing the initial information. So in this case, 6 degrees is very close to 5.9 degrees for our femoral to anatomic axis resection. If this was off by quite a bit, you may change that. Now, if you move the tibia out of the way, you can see that those resection levels move up and down and stay symmetric. And so if you want to move the tibia up or down a little bit, it is tied to those original resection values. You can see that here. And now I want to go to a smaller size tibia, and there's too much exposed medial and lateral bone. So we're going to go up to a size 6, and really could go on up to a size 7. Now I'm going to size the tibia on the AP view primarily. That is where you're going to decide what the right fit is for the tibia. But I do like to go ahead and get a decent match on the lateral side as well to ensure there's no AP overhang. And if you need to check your angle of slope, you can also do that. I'm now going to go ahead and select my femoral implant. And with the femoral implant in place, we're mainly going to look at this on the lateral view, but we also want to have it roughly in place on the AP. Now here too, as you move the implant up and down, it's going to change those resection values. And if you change your angle, it's also going to change the cut angle, and it's going to show you the effect of that on your medial and lateral femoral resections. So once we've determined that, we're now going to go over to the lateral view once the AP view is fully set, and we're going to size based on that lateral view. Now, to do that, you want to look at the fit, and I'll look at the anterior flange. And first, I want to put just a little bit of flexion into this implant compared to where they placed it. And I'm going to move this down so the anterior flange is contacting right along the anterior surface of the femur. I now want to look at the fit of that implant in relation to the curvature of the distal femur and along the posterior condyles of the femur. And so this looks like a fairly good fit, and we're currently at a size 6 implant. I apologize, that's cut off on the left side screen, but this is a size 6. And we're now going to go to the alignment tool through the tibia, and this now aligns the femoral and the tibial implants and lets you get a fairly good idea that these implants are going to be well aligned. That feature is not available in the lateral view. Now, once we have this information, we're then going to go ahead and write in what our implant sizes are, so we're able to see that in the operating room. And I like to write that directly on the AP image. We're going to blow this up to a bold size 16 font so we can actually see it. And once that's completed, we've got our information for our sizing, and we're going to go ahead and save this report. We've now completed our templating, and we are ready to go to the operating room. I'd like to go over how I utilize the templating in the operating room for information during the surgery. So I like to have my long-standing view up with my resection levels along with the lateral and the AP view. Once I've got all these pulled up, as we start the case, I will do my distal femoral resection first, and this guides me on how to set my intramedullary alignment rod. So in this case, I would have it set to 6 degrees. I'm then going to look at my distal femoral resection levels. So these are fairly symmetric. We're at 10.9 and 11.5. You can use a true measured resection technique and measure each fragment, but I use this to relatively make sure that I'm going to make a symmetric femoral cut, and I'm not so absolute in measuring the numbers. I then next turn my attention to the lateral view after I've made my femoral resections and see that there are a large number of osteophytes here that I'm going to want to remove. And then I utilize the templating to guide my tibial resection. And so I know that I'm going to be taking more off the lateral side than the medial side. And so I use that information once again intraoperatively to ensure that I'm making fairly appropriate resections in relation to the mechanical axis. I now want to take a few moments to look at the results from this patient's surgery and how I'll typically assess implants postoperatively if there are any concerns. So I'll get long-standing AP and lateral views once again, and then While I'm in clinic with the patient, I'll typically do a simple line from the center of the hip to the center of the ankle to show them how we've changed the alignment of the leg. But if you need to get more information, I'll utilize the tools within the PAC system, and I will draw a line from the center of the femoral head down to the trochlea to get my mechanical axis, and then draw a line across the implant surface, and this should be at 90 degrees if you have aligned the femoral implant to the mechanical axis. And in this case, we're at 91 degrees. A similar line can be drawn for the tibia, where a line is drawn from the center of the ankle up to the implant, and you then draw a line across the face of the implant, and we're right at 90 degrees in this case. You can also use the TraumaCad software to do this with its outcome tool, which can be quite helpful. So in summary, I utilize the long-standing x-ray to get my alignment and my resection levels, the AP x-ray for tibial sizing, and the lateral x-ray for femoral sizing. Thank you for your time, and I hope you find the video helpful and useful as you use TraumaCad software to plan your total knee replacement.